Nomophobia. So no is no, mo is mobile, phobia is a fear.
In this generation, I've seen a lot of people Googling their medication and seeing that they come back, oh doctor, naku idra pattadani ee medicine cheptundi, but I'm feeling okay, but I am losing sleep after reading all that,
ఒక పేషెంట్ వచ్చాడు. He brought me a ChatGPT printout. So he got his psychiatric diagnosis in, he got all his symptoms in, and ChatGPT gave a wonderful picture summary. It wasn't even a psychotic picture, ఒక psychosis కూడా వచ్చేసింది దాంట్లో. Relative of mine, 65 plus, he's telling me of the new WhatsApp update. ఈ feature వచ్చింది తెలుసా నీకు? And I didn't know about it. So these
I think it's like we don't know much about Snapchat.
Yeah.
I think
the Gen Z kids would teach us about it.
Yes,
True.
we don't know so much that is happening. The new slang for it and all that. Hi everyone, I'm Dr. Hima Deepthi. I'm a nephrologist at Arete Hospitals. Today joining me here is Dr. Vishnu, who is going to talk about social media addiction and the mental health perspective of it. Hi Dr. Vishnu.
Hi Dr. Deepthi. So, social media addiction is a very huge topic, as you know. And since the COVID era, the post-pandemic era, it has increased tenfold, to be honest. Now, it affects us physically, it affects us mentally, like any other addiction, be it drugs, alcohol, smoking. And yes, we live in the Gen Z generation. So, Gen Z, what is Gen Z? So Gen Z is defined as the kids who were born into the social media era, and they started using social media from a very young age. So they inevitably are going to use it. And 9 out of 10 Gen Z kids have social media. And in the US, it's even more. So a kid, boy or girl, at age 9, 10, have social media profiles, be it Facebook, Instagram, etc. So that is one frightening statistic. So now the podcast that we are doing today, social media addiction and how it affects our mental health, be it all age groups, the kids, the teens, the adolescents, young adults, and geriatric population as well, is what we are going to dwell today into. So, Dr. Deepthi, have you come across any interesting topics or patients who come to you in your clinic practice?
So I see on a day-to-day basis that a lot of younger population, may I add, that they often come with questions about their disease, which is good, with kidney disease from my specialty point of view, kidney disease,
Right.
obviously. It's a good thing to Google and learn about your disease. It is definitely good. You need to know what you're suffering from to know better what to do better and all that. But a lot of people just usually tend to Google medication and try to see all the adverse effects, and which may or may not affect them, which may or may not be applying to them, but they still Google all the symptoms. And earlier it was hypochondria. You think you are affected with something, but turns out you are not, because you Google everything. You will end up with some disease or the other, right? So in this generation, I've seen a lot of people Googling their medication and seeing that they come back, oh doctor, naku idra pattadani ee medicine cheptundi, but I'm feeling okay, but I am losing sleep after reading all that, So which comes first? Either the symptom or are you going looking for the symptom?
Correct.
So is there a term for that? Are we calling it still hypochondria?
So hypochondria is a medical condition. Yes, there are a lot of terms which can pop up on the internet, the cyber terms, which may not be accurate medically. So hypochondria is a mental illness for sure, where the person is very much worried, overthinking about his mental health condition, as you know, and a small thing, it might be something which is treatable, but for some reason, XYZ in his head, he gets a notion that it's very serious, fatal, and if not treated immediately, he might even die. Now, I'm sure in your practice with the kidney disease, it might be very easy for you to treat medically, but they might come to you for a surgical option. Googling, saying, "Hey doctor, I came across something, a new radical treatment in Europe. where, let's do the surgery and, I'll be treated, which you might agree or disagree with. So, small example, because uh, in my practice, so it's hypochondria. Now, the latest term online popping up is cyberchondria, which is a combination of cyberspace and the chondria, which is again the body aspect of it. So now cyberchondria is the same thing technological wise nowadays is you Google the symptoms and then you research it online because there's so many various health portals online nowadays. You have very good things as well, Medscape, Harvard University, Stanford, and Indian aspect as well. We have good journals online where we can.
Yes, it's about finding reliable sources.
Exactly. So you got to go to reliable places and, medically which are authenticated to give such information by professionals. And then they try to do their own research. Now we know how to place 1 plus 1 as 2 because we know we have studied that since our undergraduate. But now patients, even though they're educated, they watch these YouTube channels by influencers or, read random multiple 10, 20 posts and they mix and match and come up with their own new theory.
It's all about finding a reliable source and if the health influencers have done their research or not. Because if you go on believing everything that the internet says, you will land up in trouble for sure.
True.
Because the people have a lot of answers on social media or YouTube or anything saying that take this medicine, it will help you. Take this leaf, it will cure your kidney stones. Take ఏ ఒకటి XYZ మెడిసిన్ తీసుకోండి అన్ని ప్రాబ్లమ్స్ సాల్వ్ అయిపోతాయి అంటే there is no one cure for everybody. Each
Correct.
condition is different. The sooner people understand that your condition might not be the exact same as what is being told on social media. True. Or the health influencers, I think that would be it's not one size fits all. So you have to find your solution.
So, Dr. Deepthi, ChatGPT and AI, which is now the future. What is your take on this perspective, and how is it helping medical field? What are the pros and cons in your opinion?
That's a very good topic we are talking about. ChatGPT is the revolutionary thing of this decade and the future, obviously. The AI, it's all about
Yes.
AI. So, yes, I use it too. You needed to make presentations or write an article or something. Use it, but at the end of the day, you have to put in your input too. In the same way, when patients look for answers on AI, like they put in their symptoms and expect an answer or a solution, it doesn't work entirely well. It's still flawed. It needs some perfection because it's not like one solution. There needs to be an editing in real life. You have to come back with answers. Like you can't just put in your symptoms and expect a solution because
Right.
it's going to be a lot of fine tuning and seeing what fits you. It's about personalizing and customization, even medicine wise. So it is not as simple as just typing your symptoms and getting an answer. Use it, but responsibly, and not jump to conclusions or don't end up with some horrible diagnosis just because AI told you so.
Correct.
Seek a professional opinion and then figure it out. Take it from there. Use it responsibly is my take on it.
Very well said.
Oh, you also see the effects of ChatGPT and AI in your practice?
A lot, actually. So, what in my field, okay, the patient is already anxious, worried, or depressed. In that negative state, the patient, he or she, might want some comfort, and sadly, the comfort is given by family or caregivers. But what is happening is they go to Google or AI Chat GPT nowadays for comfort because they type in the symptoms, be it what, and also they're typing in, I heard, actually my patients told me this, all the blood tests. Okay, my hemoglobin is 10, 11, is it okay? And the AI gives you some answer. Okay, your anemia, your this, that, or for example, you need an MRI, you need a blood test for so XYZ reasons, whatever they're typing. Hey, I have a stomach pain. Obviously, it's going to say take a CT abdomen, get an ultrasound. You don't.
Way to go.
There's a way to go. There it's going to give you all the options without thinking the consequences because that's a AI. And yes, definitely, if you could come to the doctor, we're going to tell you the same thing, maybe if it's required or not, after the physical examination. The AI is not going to physically examine you, it doesn't even know you. So that sadly is one thing I see in my practice where they come anxious and they overly, state or increase the symptoms themselves. It might be 20%, 30%, but in the head it becomes 40, 50, 60. And AI increases it to, 100-fold. So interestingly, one example I can give you is ఒక patient వచ్చాడు. He brought me a chat GPT printout. So he got a psychiatric diagnosis in, he got all his symptoms in, and ChatGPT gave a wonderful picture summary. It wasn't even a psychotic picture, ఒక psychosis కూడా వచ్చేసింది దాంట్లో, because it's a differential diagnosis. We know how it is. So అది చూసి డాక్టర్ మీరు పెట్టిన మందులతో నాకు ఈ సైడ్ ఎఫెక్ట్ ఉంది, నా కిడ్నీ మీద ఎఫెక్ట్ అవుతుంది, నా షుగర్ పెరిగిపోతుంది. He's already diabetic and he's taking so much chocolates and cake because he's eating that to get a dopamine rush and feel good. And దాంతో ఏమవుతుంది, షుగర్స్ ఆటోమేటిక్ పెరుగుతుంది and he's not taking medications on time. So he's correlating అది whatever ChatGPT said with my medications as a side effect. ఎందుకంటే ChatGPT చెప్పింది.
What they read is different from what they feel and all that. So that's certain mistrust about doctor's prescription. That's not entirely helpful for either us or them.
This was actually bad because in my case, he even stopped the medications on his own because ChatGPT said that, and he took another alternative, which the AI told him to, and I didn't even know that. He came after 1 month at the follow-up saying, I need a new prescription. So ఇప్పుడు AI చెప్పేసింది, ఇప్పుడు AI చెప్పిన మందులు నేను రాసి నేను స్టాంప్ వేసి సైన్ చేయాలి. So
you have to listen to this computer.
yeah, so ఇప్పుడు good thing I have to listen to the AI which I don't even know. So sadly, I took another half an hour to console him, to convince him. Yeah, it made it harder.
Because you have to convince the computer and the patient now. So it's
I thought the person would listen better, but he was even more stubborn.
it's not a straightforward thing with the computer and AI being involved. It has its benefits obviously, but people getting addicted to these kind of seeking answers. It isn't human tendency to seek answers.
True.
What you're suffering is somebody else in the same journey. Do you see a lot of psychological impact of this kind of behavior or social media addiction? What do you see, Vishnu?
100%, Dr. Deepthi. So now addiction, like any other form of mental illness, or it starts off because a patient is in a certain state of mind, not necessarily depressed. It can be just looking for something. He's eagerly looking for something, searching for something. So in that search, he might come across, for example, on Instagram, certain things that will make him happy. So that is one aspect of the addiction part. But the psychological aspects that I see most commonly is due to overusage. People are getting depressed. Now, like we discussed statistics wise, in the teenagers, adolescents, males use more of social media. And in the females, 25 to 35 year age group, they are the more brackets. Then they use more social media. Now, social media usage in the world, according to data, number one is TikTok, so WhatsApp, Instagram, and Snapchat. Snapchat is also there. So now looking at that picture, the algorithm that AI and everything the computer has formed, that has taken over from the past 6 to 7 years. That is the Instagram algorithm, the TikTok algorithm. They know what you watch. So have you ever seen, maybe you click a picture and like for example, shopping, just say in your example, then the next feed from the next hour is all about that particular shopping.
Yes, it's all.
Or you click a beach photo. Now your Instagram is filled with vacation. Now it's
making you
yeah.
go in a certain way, buy certain things. That is the AI and the algorithm trying to teach you and take you in a certain way that it wants you to. And then there are kids who compare themselves to people who are actually doing other things and taking pictures and editing them, Photoshop, because they have this body image issue that they have to look perfect, chasing after perfection.
True.
And trying to look a certain way, shop certain way, dress a certain way, and even take vacations or relationships.
FOMO.
Yes, exactly. That is the word. FOMO. It's like you see your friends partying or something and you're not invited and they get FOMO. And and they compare themselves. Kids, I won't even say it's just kids. We've all been there.
I had FOMO last month.
Yes. So we it's a daily thing for us now because we are seeing what is happening with everybody, and we're constantly wondering, are they doing better than us or living better lives than us, trying to see what the other person is doing. But you see a lot of people losing sleep over this and getting anxious when they don't have their phones with them. They can't be parted from their phones even for like half an hour or something. And it's like constant need for validation, external validation, instant gratifications,
True.
and all these kind of things. So, do you see people like trying to be, trying to match up with their peers and then being constantly disappointed or depressed that they're not at the same place that the friends are or
Right.
peers are or something?
Right. So now it's a stepwise thing as well. There can be anxiety, there can be depression. Like you said, there is insomnia, sleep disturbances. People sleep very less because they're on the phone like till 2 or 3 in the morning. Blue screen radiation, blue screen that activates your brain. Now, how are you going to go to sleep when your brain center, which is responsible for sleep, is active?
Yes.
So you're forcefully trying to make yourself active. When you think I'll watch TV and sleep gradually, but no, it doesn't work that way. So now that again causes migraines or headaches, irritability the next day, crankiness, loss of attention and focus. Also, a dangerous thing is when that happens, I see a lot of RTA, road traffic accidents, because people are like, drowsy the next day because lack of sleep. They might go speed or just,
Texting while driving,
right.
that is a big deal.
They're even watching reels while driving,
Making reels while driving.
making reels while driving, exactly.
So it's not just one thing, it's a whole physical and emotional part. Why is it so attractive, Dr. Vishnu? Why does social media so easy to get addicted to? Why are we in the trap?
And now social media addiction, like any addiction, is medically a neurobiological component, and dopamine, which is the main culprit, I feel, which is a neurotransmitter. Okay, it's a happy hormone in simple terms. So the more you see good things, like example, beaches, shopping, sports cars, you know your brain is excited, it's giving you that happy hormone, and you're excited and you feel good about yourself. Suddenly, from sitting like lethargically, in the office, you're bored, you're just watching something and it's making you happy. Now that's a new concept which has come up in the recent few years. Attention span, due to this algorithm, the AI or the Instagram algorithm has changed. The real concept has turned everything upside down.
Yes.
Attentional research wise, a lot of publications have done research on this. The normal attention span before used to be around 2 3 3 minutes, but now apparently it is down to 30 to 35 40 seconds,
The real duration.
the real duration. And they have already done this research, these big companies, and they have made it in such a way that we are attracted to a reel for 30 40 seconds. And kids have complained that any reel more than 2 3 minutes, it's not going to interest them,
For them.
it's not even going to register to them. And sadly, the problem is, you see a reel, and by the time you skip to the next 2 3 reels, you will forget the first reel that you saw.
Yes.
Undoubtedly.
It's nothing going to stay with you. And even the algorithm makes it that you don't have to scroll, it goes to the next reel.
So it in a way controls what you watch.
And I've noticed nobody is without their phone these days. Like even at dinners and everything, everybody is with their phone on metros and trains. Everybody, earlier it was newspapers maybe, but now it's phones. How are people so scared of losing? Is it because they lose their data, or is it because they lose touch with people? Is there something that also is a worrisome factor in that? Is there something like, you know are we trying to go towards a thing where we are attached to the screen always?
Excellent question, Dr. Deepthi. So, in recent times, a new medical term has come up, a nomophobia.
No more.
No more phobia.
Okay.
So, no is no, mo is mobile, phobia is a fear. So, as in the medical terms, we know there's so many phobias: fear of heights, fear of plane, fear of snakes, fear of animals. So, now fear, no phone is a new fear. So, it can be
So we are there already.
oh, we're there. We're there. It is research. It has been proven. A study done by a European journal. they took like 500 candidates, and in that they found that a person without phone for a certain duration have increased anxiety, increased depression, palpitations, tachycardia. All the symptoms are also there.
Like a typical de-addiction.
Exactly, maybe a withdrawal. Yeah. There's every component in the body. GI symptoms. There's again kidney symptoms like increased micturition. The urge to go to the toilet at least, sweating. So all the withdrawal symptoms typically are there. The autonomic nervous system is again activated. Then what we found in that research is it is typical to a phobia. Now it can be to multiple reasons. There's very very important data. It can be pictures, private photos, or bank details, or contacts.
On the interweb, we are all
Exactly, everything is there. Or it can be now whatever we use like UPIs, GPay, the password, the banks are there.
we're so dependent on it.
Hmm.
Is it just that, or is it because a lot of people just like, you can't be away from it? Like, even if for the duration of a chat with friends or something, you need to keep looking at your phone and all that. You feel like, a sensation like, oh, did my phone ring? Is it vibrating? And you feel like, that something is going on
Right.
behind the screens. I mean, you're missing something while you're talking, even with friends, even without losing the phone. It's like you're constantly having to look at the screen. So that is a problem, right?
It is. Again, it is the neurotransmitters in the brain which are going to help or increase the problem. So, dopamine is the happy hormones. We have serotonin, the feel good hormone. We have oxytocin, norepinephrine, epinephrine, as you know. So, all these play direct, indirect roles in the brain. Now, impulsivity is a huge problem. Uh, just for an example, when we were kids, internet would be so slow just to reload a page.
Connections.
Dial-up connection, right, with the landline. So మనం enter కొడతాం 5 minutes. It used to take time to load. We used to wait patiently.
It was a family computer.
Oh yeah.
It was not your personal.
I still remember my computer used to be in the hall beside the TV, and they had to see what I was watching on the computer. And that was the safety measures which our parents had in 94, sorry, 95. I think I had my computer in 98, 99, my first computer. Yeah, parent controls. So now in this impulsivity, the patience level is coming down with the kids. Now the internet feed is 5G. Now 6G is coming up.
You don't wait for the
No, you want everything like that. Instant gratification, like you spoke about, instant happiness, instant, that rewards. That is the problem. So the dopamine pathway in the brain is activated so much, and you feel so happy in that moment, you're addicted to it. Just like what alcohol does, or nicotine does, or any drug does. It gives you that instant dopamine rush, which makes you happy, feel good. So even you're depressed, you do that, and you do it over and over again.
Vicious cycle, not to Vishnu, like you see kids compare themselves, like complexion wise, clothes wise.
Yeah.
There's a lot of words thrown around casually, like, be thin, or body image issues stemming
Definitely.
from this, trying to compare yourself with the other random person, not the influencers. You see, influencers are online and they market themselves in such a way, but we don't see it like that. They kids, especially impressionable age group, kids and adolescents, they try to compare themselves. We've done it. We've compared ourselves. So
Definitely.
I think kids. Is it too late for us, Dr. Vishnu? Are we too on the brink of self destruction, or are we okay?
So, with any new technology or see, AI came up recently, but it's been there. Google has been there since forever, but the technology is upgrading and enhancing itself. So with every new thing, I feel we need to adapt ourselves better, know what we need to do, and maybe for the next generation, for the kids, we can guide them better. Like you said, maybe I've seen a lot of body image issues, patients complaining of seeing people on Instagram in a certain way, models in a certain way. But then, a lot of it is apps, I feel, as well. Maybe you can elaborate on this, like photo editing apps, Photoshop, I don't know.
Editing everything, you take a picture, then you say your eyes are squinty or your eyes are too far apart, and there are AI apps that tell you to better your face, or it's kind of like plastic surgery
Right.
but on AI. So it tells you what is wrong with your face, and these kind of things mess with young people's body image, self-esteem, all that. They keep thinking that there's something wrong with themselves. And also with a lot of awareness and a lot of talk about LGBT issues and all that, people should be more accepting of themselves, instead of comparing themselves, like, I want to be like that person, I want to look like that person, or I want to behave like that person. I think individuality should be a big issue, because uh, if we're all made of the same mold, we'll all look the same, and ultimately gender dysphoria is a word we're hearing a lot these days, and a lot of kids with body image issues. It's not simple, I can give you that. How would you deal with a young person who comes with you with body image issues or difficulty accepting their gender or something like that? How would you deal with something like that?
It is pretty common these days in the Western culture, European as well. India is seeing a surge in these cases of gender dysphoria, gender identity disorder, the crisis, because of the stigma is coming down. Yes. Awareness is increasing. The social media presence of the LGBT community is increasing. Yes. A lot of governmental laws have been implemented to safeguard these communities. And I do get a lot of clients, but then again, they are afraid to come to the hospital, number one, because of someone might see them there and they might be exposed. So they prefer to be more private, but it is definitely improving.
They also do suffer from mental health issues, don't they?
Definitely, definitely. So gender dysphoria is a condition where the the patient basically he has immense distress, discomfort, and there's a problem for the person to accept his birth sex. Yes. And the present gender sex. There is a conflict between that. So he might have been born a boy, a male, but the dysphoric aspect comes in where he feels that he's connecting more with the opposite sex and the gender. So he feels and is more connected with the females. So there's always an internal conflict within the persons, consciously and subconsciously, and that causes chronic distress such as anxiety, depression, mood swings, anger, outbursts, and isolation, self-esteem issues. Again, like you said, body image issues. And there are also some cases where I've seen self-harming behavior. So now they harm themselves. It might be through cutting at the wrist, or small, people place their palms over the fire just to hurt themselves to get away from that pain which is internal.
They don't understand what it is, what they're going through.
So, yes, exactly.
They might self-medicate also, I think, take medication and or get addicted to other chemicals and drugs and all that. They're easy target for all of these, and a lot of bullying. So to get away from all of this, do you have a lot of people with this condition trying to take drugs and self-medicate?
So a lot of my clientele would be from, at least in this gender dysphoric condition, from the teenage, 17, 18 to 20 brackets. Now, yes, like you said, there's a lot of bullying because it opened up to someone and that has leaked for XYZ reason. We hear a lot of stories on Twitter, YouTube, you know, they trust a best friend, that best friend goes and tells someone else's best friend, and the whole college or school knows about him or her. And then they go into depression, they start harming themselves. Worst case scenario that we are afraid as psychiatrists is suicide risk. So that is one thing we are worried about. And then they get addicted to pain meds, pain medication, opioid medication, and they start taking that to numb themselves. Then they come to the doctors, then they get, they buy illegally our prescription somewhere else, like sleeping tablets, and they get addicted to that. Then increase in alcohol, increase in smoking. Now, the other illicit drugs also are playing a major role these days. Can be marijuana, can be heroin, cocaine, LSD, amphetamines. So everything is playing a role in their neurobiology. And when they're supposed to get better, it's actually doing the opposite. They're getting even worse. What is your opinion on obesity and all the miracle drugs that people are talking about these days?
Ozempic. Yes. So Ozempic and Wegovy are the drugs. Like that has been the biggest talk of the market since, I think, since maybe all these weight loss trends have started. It is, medically speaking, it has been approved for weight loss, and a lot of medical boards have approved. It has helped people in losing weight, but I would advise a lot of people who take them indiscriminately to not do that. Seek a physician's help, come to us, see if you're the right candidate for it, know what side effects you can expect. Yes, you will lose weight, yes, you will look a certain way after you lose weight and all, but there are also metabolic side effects of that, like, you could, your sugars or your cholesterols and all these could fluctuate. There are benefits, but it lasts as long as you're taking the medication. Like, I see a lot of people who have no indication for it, who are not like morbidly obese or anything like that. It's actually a diabetic drug, which is being marketed as a weight loss drug. Yeah.
Okay. So is it a prescribed medication?
Yes. So even for weight loss, you can prescribe it. But a lot of people who come and seek the prescription are not really the actual, who don't need it in real life. Maybe you could try another way, but it's not harmful. But if it is indiscriminately used, it is harmful.
So in your practice, do you see people abusing it?
Yes, they kind of abuse us in the sense they keep on taking it, and then after a certain level, it kind of plateaus. Obviously, they kind of stop taking it, or they gain weight again, and then they get depressed again. So I think one of the social media benefits of that I've seen was that, like, let's say Oprah Winfrey was avid supporter of Ozempic, because she said she faced cyberbullying all through her life for being overweight or something, and she's taken Ozempic, and she speaks that she feels better, physically, obviously, and also psychologically, because she feels that she's finally accepting of herself. But how long can we rely on a drug to do that? We need to learn to get out of
The future studies and
Yes. How can you continue taking a drug? I'm sure I'm sure people will gain weight after you discontinue the drug after a while.
have you seen cases, Dr. Deepthi, where you ask the patient to stop Ozempic, but still they go to the pharmacy and buy it and use it themselves?
In India, we don't need a prescription. So I think once you give them the prescription or the distributor, they figure out where to score it.
Okay.
And they self-medicate and continue taking it. There has been a shortage of the drug because of indiscriminate use. The people who actually need it, the morbidly obese and diabetic patients who actually need it, weren't able to get it because of the shortage of the drug. That's a true story.
So maybe that can be to addiction in the
Sure.
future.
Yes.
Weight loss addiction, weight loss drug addiction.
It was always been there since the 80s or 70s, I think. That's how Coke came up, right? Yes. So for the weight loss first. So this is a newer FDA approved drug all over the place.
So, Dr. Deepthi, in our regular day-to-day practice, we see so many cases having chronic illnesses, patients sadly suffering from many years. And I'm sure you must have seen a lot in your practice as well with end-stage renal kidney disease or chronic kidney disease. What is your take, and how do you deal with such families and patients who come to you for your help?
Yes. So it starts from when you give the diagnosis of kidney failure. Sounds scary. A lot of people go into denial. A lot of times we take more time in counseling them, saying, it's an illness like any other illness. So you have to continue support from the family also. That is important. Family support is important. And there are a lot of things on social media like support groups. Like if you have lupus is a disease which a lot of celebrities have openly talked about. Like Selena Gomez has a support group. She is a chronic kidney disease patient. She had lupus and she underwent transplant. There are runs and support groups and meetings, and there are even games organized by dialysis patients, trying to keep them as normal as they can, like integrate them with regular lifestyle, and keep them as carefree as possible. And talking to your doctor, yes, share your concerns with your other friends or family. I also see a lot of, we only talk about the patient point of view. We often neglect that even the caregiver, the primary caregiver, you're watching your loved ones suffer. that is not an easy thing. So we do periodic check-ins with the caregiver also, so that they don't burn out. Because taking care of a sick person itself is, psychological. It has some psychological impact. So if I feel at any point that it is getting, difficult for the caregiver too, I usually refer them to you in such instances. And patients also should, share and, talk with other people and be as regular in their day-to-day activities. That is the idea, not to make them feel like they are the patient, and, keep them as simple as possible, least medications if possible, and dialysis, whatever. It sounds scary, transplant and dialysis and all this, it is scary, but the idea is to, make them as independent as possible and do their daily activities as much as possible by themselves. Support groups I usually refer when I'm unable to, like if they're losing sleep or if they're depressed, I usually refer them to the psychiatrist or the psychologist, a couple of sessions here and there, just to gain some perspective, help them connect with other people of similar.
Yes, definitely, because a lot of things go underdiagnosed. And like you said, the person taking care of the patient is equally important as a patient. Because if he's affected, the patient care will definitely fall down drastically. So, yes, we do add medications on very low dose if needed. And majority of the times, just that support group that comes into play, like you said, group therapy or counselor therapy with the counselor, it does make a difference without medications also.
Yes, so it's all about forming your own group of people who will support you and lift you up.
Exactly. And I think at the end of the take-home message should be there's always hope.
There's always hope, and you always find help somewhere, even if it is on social media. I mean, this is where social media can help you, really. Because you find you feel isolated and alone most of the time. Like, am I the only one suffering? Why me? So then you go online, you look at your conditions, see people who have similar afflictions, share the stories. Yes, form a community, and then you can associate and relate to people. That is where I feel when celebrities talk about their mental health struggles or their life issues or problems, I feel that makes them more relatable. And that is a good aspect of social media, because then you can understand that everybody has problems, and it comes like you can relate to them. Like celebrities, a lot of celebrities have been talking about their mental health struggle these days, and it has become more accepting to seek therapy or seek help. So I think this is where, for the good, we've been talking about all the cons so far, like how it is comparing yourself and all. Now I would like to use a more positive word for it. It is more relatable to see somebody else going through a difficult struggle or something like that. Like we see the good aspect, like I said, Selena Gomez is all about the diva life and all that, but she has kidney disease, she has undergone transplant, and she faces the side effects of all that. You're just human as yes, yes, ultimately are you a human, that's it. So all of us, you have to make it as relatable as possible. Find your group, find your community, and I think that's where you can find solace and strength from. Yeah. So you must be seeing a lot of these on the news also. We see a lot of these celebrities talking about it, health, mental health struggles and all that.
So, like you said, Yuti, a lot of social media attention for mental health is still coming from the celebrities. We need to do more on it. Yes, definitely the medical fraternity does it. News media might do it. But yes, when you relate to a celebrity, be it a sports star, actor, actress, it connects more and
Yes.
resonates more.
I think you put them on a pedestal, and you see, want to have that kind of lifestyle, or that, compare and everything. When you're comparing everything, comparing your struggles also might help in a way that makes you not feel alone. And
It breaks the wall. It breaks the ice. I feel it reduces the stigma. Yes, if a celebrity tells, "Hey, I went to a psychiatrist, I went to an oncologist," so there's nothing wrong. You cannot go as well. They might go,
yes,
or at least dare to take the first step. Yes, and then it makes it easier. The good process is taking that first daring step. and then it is.
Yeah, celebrity endorsements, not just for brands, for healthcare as well. Like get your, you know, breast mammograms and all that, you know, screen for cancers or get a routine screening test for diabetes or lupus or whatever. So that will help you get aware that, you know, there are certain words that you don't hear normally and they hear it from their celebrity, then you get that reminder that, you know, if you need to go for your checkup or something. Yeah. And even lifestyle changes also, like a lot of people are taking up running and, you know, exercise and cardio and all that. Keto diets and lot of these medication, not the medication, but the lifestyle changes that they're incorporating can also be a positive impact for a lot of people watching and emulating celebrities.
So a lot of these things, as we see on Instagram or whatever social media, Facebook is the athletes or the fitness influencers. Now they do a lot of reels, do 10 push-ups a day, 10 kickstands or whatever. You'll lose abs. You'll lose weight. You'll get abs in 6 weeks.
Yes.
I don't know how true it is, but consistency.
Feel motivated.
Yeah,
Why not?
at least it pushes you to do it. Started well, good for you. Then go to a professional trainer, go to a gym where there are certified professional trainers who can do the proper way without harming your body.
Yes, and taking these, I think a lot of people use supplements also without proper knowledge of what it use, and so I think it should be a little more careful. Do it, but be when you're taking extra, putting something into your body, just be.
And a lot of these things affect the kidneys, if I'm not wrong. The
Supplements, yes, bulking agents and creatine and a lot of these. High dose protein is not good.
proteinuria.
Protein and that, and what happens is it long term effects. Like you take yeah, it does, and that has something called creatine, and some have like herbal remedies and anabolic steroids for bulking and putting on muscle. We've talked about Ozempic on one here, but then some people are trying to bulk up as well. So I think it's just you have to take a professional, like a fitness trainer. You need to take a professional opinion too if it's really affecting your body in the long run and see. Same goes with diet. You can't just go for one meal a day throughout life.
So now coming, like you said, the pros. Now there are a lot of cons as well, as in this 21st century, digital scams are so on the rise.
Scary. Yeah.
It is scary. Now, sadly, addiction, social media addiction has come into different forms, digital media wise. There is gaming addiction, there is video game addiction, internet addiction, there is pornographic addiction, and there is shopping addiction also, which is on the rise.
Yes.
A lot of people shop Amazon, all clothes so much which is unnecessary, and they swipe these credit cards and they go on increasing their loans, the credit loans, and it becomes so bad that then they end up having depression and suicidal thoughts and low self-esteem and confidence.
And you end up in debt, more importantly. Like it's this idea that you have to look a certain way or buy certain clothes, or the need to look perfect or get surgery or cosmetic therapies or whatever, to look a certain way based on what you see on that will run you into the ground. Your your credit and everything will run into the ground, yeah, in the long run. People go into debt, I'm sure.
Definitely. So I had a case a few months back, gambling addiction, betting with IPL cricket, and sadly, it started with small amount. He made some money, he lost some money, but he used to stabilize it. Then the rush what to him. That impulsivity that we were talking about is dopamine rush and that excitement which he had. And then he started betting high, 15 lakhs, 20 lakhs.
High as well.
And he got huge amounts in return. So what he did, confidence increased. That overconfidence is what I would say. Increased it and kept putting in more money. They lost, and to get that money back, kept again infusing money, taking loans from friends, lying to his parents. He even sold few properties apparently. And whatever said and done, it went into crores. And then he balanced it. At the end, when his family got to know, his outstanding debt was 50 lakhs.
Wow. That's horrible, yeah.
That time, the parents had to get him to me. We had to admit at a rehab center, start the medication and counseling. But still, it's such an uphill task, paying that 50 lakhs from now he doesn't even have a job.
Poor family.
He lost his job. His lawyer is, I don't know what his parent family status is, but definitely his wife was not happy. His kids were not happy. So that's why
It's the same vein as drug addiction, and everything is on the same vein. I think it triggers the same happy areas in your brain, and then want the rush. You frequently want the rush. You seek that rush, so that constantly gamble or shopping or whatever, gaining.
we call it high risk behaviors. It can be rash driving, racing, motorbike racing after drinking, or car racing on the roads, or doing drugs, etc. Recent as international news, I think you almost have heard, is One Direction pop star sensation Liam Payne. Sadly, now allegedly or whatever, we cannot go into details, but according to sources, he was under the influence of multiple drugs, including alcohol. The whole day he was having fights with everyone in the hotel room, breaking stuff, erratic behavior, aggressive behavior. And then now we don't know what happened on the balcony. He fell accidentally, and then that was a huge trauma to the world.
He was so young, and he was so inspirational at one point. Unfortunately, he fell prey to drugs and all that. And
So I've sprint to his Instagram page. He has millions of followers. Which
so I feel like that affects the followers in some way or the other.
But and then again, now I think the responsibility of you know, the group or the band should be like at least to educate other people or his fans and console,
But if you are going through something similar,
It's short.
therapy, or try to seek professional help. Don't self-medicate or do harmful things.
Exactly. So now the good news is a lot like you discussed that the stigma is coming down to these celebrities who are opening up. International celebrities who maybe we don't know had mental health issues, but they're very open about it now to various channels like
Favorite pop stars all opened up about stuff like this, like even like Katy Perry and Billie Eilish, and all of them have talked about their struggles with body image issues or mental health issues, anxiety. Most of them, I think, even locally also some actors have talked about it and formed foundations or organizations to
Deep Kapoor Kunz very well, publicized and a brand ambassador for mental health in India. She was very open about her struggles and how therapy and whatever the doctors have helped her. Now, just to name a few, this Shraddha Kapoor, Anushka Sharma, then Hrithik Roshan, Shah Rukh Khan, Karan Johar, Abhay,
so
all the biggest stars in the world.
so common that they're coming forward to talk about it, so should we, because it's not a stigma anymore. And I think find people who will support you in your lowest point of time, and then seek therapy when needed.
True.
That's it. Instead of going into the dark webs and hurting yourself more, going deeper into the mire of social media.
I feel the celebrities can help build that bridge, that gap, which is between mental health and
And there are online groups as well, online therapy options also. So I think it's not all bad. There are good aspects of social media and the artificial intelligence also, but I think it's about drawing a line till where it is acceptable and beyond which you should take actual moderation. Yes, in moderation. Yes. So, Dr. Vishnu, after this extensive talk about social media addiction, I fear I have some extent of nomophobia. So, I think it's like, yeah, I do suffer when I don't have my phone in hand. So, do you have any tips for me to help me detox from this whole digital world and try to be as present and, get away from the phone as much as possible?
So Deepthi, I try to break it down age-wise. Number one is school-going kids, teens, adolescents, then young adults, and geriatric population. Because the way they use mobiles or use social media is very different.
Consuming content.
Yeah. So research-wise, there are a lot of studies which say do not give social media or smartphones to your kids till they're 13 or 14 years of age. That is one thing I really abide by, because a lot of studies show when kids below the age of 10 were given smartphones or access to social media, Facebook, Instagram, Snapchat, whatever, have shown more pathological signs, mental health symptoms like aggression, anxiety, self-esteem issues. So that has been proven. Number two is while they're eating, keep it, focused on the food, like mindfulness. So mindfulness is living at the moment, in the present, not distracting yourself with other XYZ activities. And the parental controls is number one. Avoiding seeing adult content or which is age inappropriate to the kids. So the parents need to be mindful of that as well. And basically controlling the screen time. That's the only way.
I read on the news today that Australia is planning to ban screens for kids below 9 years of age, and it will be the first country to implement it if it does. Yes, like you said, I think it's essential that
It has been proven research wise, so I think that has to be done. Yes, the age may vary country to country according to their usage and their studies statistics, but yeah, 13, 14 is a good thing. You can give them the old phones when we use 1100 if you remember the Nokia. There's a button, the SMS, and the phone call. That's more than enough for safety and connection or communication purposes. Now, coming back to the adult population and teenagers, definitely 3 hours is what the average is person to person these days. I've been studying.
more.
Yeah, definitely more. So in our smartphone users, we have these app controllers which give you a count of how many hours you're using, and there's an option to lock the app as well. After a certain time, you don't open it. I mean, you can break the password. That's easy, but it's a small step where you can learn what your timings are.
To avoid doom scrolling into the
Yeah.
night and
Don't scrolling to the night, sleep early, avoid the blue screen after 11. Just switch off your phone or put it in airplane mode. I mean, different profession, but at least on your off days, just put it on vibrate mode and in the other room, not even in the same room.
Now we are always working. We're always on call, so we have to maybe turn down the volume or put it in vibration, and constantly worry about is the phone ringing or shall we getting a call or something.
So I think now, like you said, you have a bit of nomophobia. I think I have a bit of anxiety.
Anxiety. What is that?
So anxiety is a new term again, which has been happening since few years. Where you feel your phone is vibrating while it's not actually vibrating.
I think we all have that.
We all must be having the constant popping up of notification, that beep, that siren, the vibration.
Feel like it's in your pocket or it's ringing somewhere or it's not in your hand.
So now the term for it medically has been given is called phantom vibration syndrome.
Makes sense.
So if it's in your pant or your purse, you feel like, okay, it's something like grr, grr, it's like a beep, and it isn't. So that is again a source for anxiety, restlessness. When so you be expecting a call
That's one way. But
and it doesn't happen, you get more anxious. Why didn't I get a call? Why didn't the most common thing I see is, at least coming back to the teenagers who are at least 90 to 25 age group, selfies. They take so many selfies. You can just take one selfie or two, which is good. According to that, you're happy.
Yes.
And upload that. No, they take 50, 60 selfies and edit it, filter it.
wait for the reactions and is everybody is like them or
And then they constantly think about that after the posting. Next 2 hours is like, why am I not getting so many likes? Why did I get just 2 comments? Did my friend see the photo?
all revolution, everything is around the social media and how are your photos accepted and all that.
The other thing is, your friend saw the photo, but why didn't he or he like it? Then you would think, oh, the photo is not good maybe. And then you constantly overthink.
That is another dopamine trigger.
And it triggers your anxiety as well, not just the dopamine. You feel good when you upload it. After you upload it, you didn't get the expected result. It pokes you, it irritates you. Validation. So now that is a vicious cycle. Now you are forced to remove or delete the post because you thought you'll get 50 likes.
Good enough.
You're not good enough. Your friends didn't like the photo. It's all psychological. Hey, your friend must be busy driving. They saw it but didn't like it.
Don't text and drive.
Yeah, exactly. So we don't know what it is. So that is one, negative aspect of it. Now coming back to the anxiety. Everyone I think has it these days. The second thing is over usage or over promoting yourself on social media. Expecting validation. That is something that we need to constantly
And I think the whole take-home part of this would be practicing mindfulness, like being present in the moment. I think it's easier said than done. I think we are also victims of what is the
At least once in a while, we do need validation. I do agree.
Yes.
We all do. We humans reach at the end of days.
being in the moment, enjoying our surroundings for the moment, and not having targets or trying to fit in or something like that. I think practicing mindfulness, like you said, it's one way to detox from time to time to get away from your screen, put your screen down, and see.
So read a lot of books, at least go for a walk. Now, I tell this to the geriatric patients or at least the retired 60 plus people, you know, they're always so active now on social media. They are more active than us.
Yes, exactly.
You know, WhatsApp group, they have like 10, 20 groups. They have colony group. They have, the apartment group. They have the office group, family group, Ratri drinking batch group. And cards,
WhatsApp యూనివర్సిటీలో ఏది చెప్తారు ఫార్వర్డ్స్ చేస్తా ఉంటారు.
So they are like now the gurus of WhatsApp.
Actually, yeah, they are also equally afflicted as much as teenagers. It's like going back in the
Funny story. Relative of mine, 65 plus, he's telling me of the new WhatsApp update. You feature watching Telsa Niku, and I didn't know about it. So these
things. Think like we don't know much about Snapchat.
Yeah.
I think
The Gen Z kids would teach us about it.
yes,
True.
yeah, we don't know so much that is happening. The new slang for it and all that.
We have received a few questions from the audience asking us really candid questions and some serious questions. So I'll ask Dr. Deepthi the first question. Can stress affect kidney health? If yes, how so?
Yes, definitely. If you are constantly stressed, your BP can go up, your sugars can go up, and also you don't sleep very well. Anytime BP and sugar fluctuate a lot, your kidneys do get affected. And there are a lot of people, when they're stressed, have incontinence. They pass urine urgently or without, they're unable to hold it or frequency. That is a problem they have.
Same we see the anxiety.
Yes, exactly. It's similar. So it's really how close they're associated. In the long term, it can affect the kidney. Yes.
Could you give up your phone for a week or would you experience withdrawal symptoms? So I think I'll be very happy to give up my phone for a week. I'll, put it in airplane mode, switch it off so that I won't get any calls from home and as well from the hospital if I was lucky. Yeah. So Dr. Deepthi, can diet play a role in good health for kidney disease patients?
Yes, very much. There's a lot of talk about gut health and kidney, gut health and heart and everything. So what you eat manifests, obviously. So diet, low salt, you should have low salt. There's no difference in different types of salt. You hear rock salt, pink salt, Himalayan salt, doesn't matter. A salt aina salt. Reduce your excess protein. Avoid too much of protein. Go meatless one day in a week if possible. No, avoid too much smoking, alcohol. It's better to quit smoking altogether, and alcohol in moderation. It's always good to be mindful of what you eat as well. Okay, next question.
Does Gen Z really have the shortest attention span ever, or is it overblown? Yes and no, I feel, because yes, they have it trained from a small age with the reels and the fast growing speed of the internet. But even we have been affected in a certain way because because even I see personally, I do tend to forget the small details and I do forget some important tasks as well. But it's because I think we overcomplicate our things. We try to multitask in this generation, and that has effect on our concentration and focus at that point. But yeah, the tip for it is what I try to do or tell my clients is, maintain a small diary, or in your smartphone you have notes app. Write it down in your notes. That is your registration of the memory part, and then the recall will be very easy.
Recall is better, yes.
Yeah. So yes, I do feel our attention span is decreased.
Sure.
The next question would be, which health trend had you thinking, should I really try this?
I was very impressed with intermittent fasting that was being talked about extensively. So I found it, I'm still practicing it as much as I can. So intermittent fasting, the keto diet, I found benefits, and I try to practice it as much as possible. And it is exciting also to learn new things that your body can do, go fasting for a long period of time, and it's exciting to see how much you can stretch your body to its limits. And yeah.
Good. Do you have a guilty pleasure from the social media aspect, Dr. Deep?
You're going first or me?
You please.
Yes, yes. I think we have a shopping. This thing we add things to the cart. We on our free time we scroll shopping apps. We add things to the cart, and we may or may not buy them, but they're always sitting in your cart, and then calling for you, and you get notifications saying that your card is waiting for you. So that number in the card goes up to the 50s or hundreds, and then that is my guilty pleasure. What is yours, Vishnu?
Oh, mine. Okay. So now the big boss.
Big pause. Reality TV.
Reality TV. So now coming to when we spoke of social media addictions, there's like we only talk about
Yes.
gambling, Instagram, Facebook. Look, there's other aspect of the media which is on the rise. Reality TV.
Yes.
I wouldn't say it is an addiction, but it is part of a culture now, and we're all on the bandwagon because it is unscripted. It is exciting. It again gives you that dopamine rush. You like it or not.
And it's like it's a whole television culture is wrapped around it nowadays. Yeah.
And previously, if you notice, Deepthi, we used to, sit by the phone call for voting our favorite contestants. Elimination round వస్తుంది. Okay, చలో మనం vote చేయాలి. Phone మీద. It used to be SMS or phone call, missed call. Now it is app, or you go to that missed call or something, WhatsApp.
Just click.
Yeah. So again, that has become a sort of, I wouldn't say addiction, but a part of our culture and our daily life where that 9 అయిందంటే చలో టీవీ షో వస్తుంది, నాగార్జున గారు వస్తున్నారు, మనం చూడాలి, ఫ్యామిలీ మొత్తం ఎంటర్టైన్మెంట్ అవ్వాలి. ఇన్ అ వే ఐ డూ అప్రిషియేట్ ఇట్ బికాస్ ద హోల్ ఫ్యామిలీ ఇస్ సిట్టింగ్ ఎట్ వన్ ప్లేస్.
Yes.
ఎందుకంటే ఐ am an example of that. I'll rather sit in my room, watch an iPad or play some game. That's fine. But yeah, that's why enough to do. Yeah, we're 4-5 people sitting together, laughing, commenting. చూడవాడు అట్లా ఆడిడు, చూడ ఆమె మైండ్ గేమ్స్ ఆడుతుంది అమ్మాయి. This interaction, when we know it is not real, it may be scripted or may be unscripted, but it is a fun social gathering or family gathering where I think that is a good part of social media. So that is my guilty pleasure.
Okay.
So that ends our rounds for the audience.
Yes.
And
It was fun. That was a interesting session we had today. I learned a lot from you about social media. We've seen that there's a lot of pros and cons, and that there are goods, but you have to take them all with the bads as well, the cons as well. So drawing a line, understanding where you have to understand how it is affecting you positively or negatively. It's just practicing mindfulness, like you said.
so everything in moderation is okay. We use it, but not too much, too less. But whatever is needed and adequate. I think that is the take-home message. Do everything in moderation and in limits.
I think the listeners who have logged in will understand that need to take it with a pinch of salt. Everything we say or everything they hear online is not entirely true. So you have to understand
Don't fall for it so easy. Yes. Everything, do your own research, be conscious and intelligent about it.
Yes, be smart. Yeah.
Be smart.
Yes.
So thank you everybody for joining us today on our episode 3 of our podcast Beyond Medicine by Arete Hospitals. We hope it was insightful and educative and candid enough for you all. So if you have any comments and questions, please do leave them in the comment section below and we will get back to you as soon as we can. If you do like this video and our podcast series that we are doing, please do like, share with your friends and family and subscribe to the channel. Thank you.